I'm going to introduce our next speaker, and it really is a special privilege to introduce her. It is Dr. Gowri Gopalakrishna, and she may hardly need an introduction for the audience here, as she is the lead investigator, or shall I say, the force of nature, who made the National Survey on Research Integrity into a big success. She's an epidemiologist and methodologist by training, with many years of public health experience in various professional roles. And you may also know her, if you live in the Netherlands, from her appearances in the Dutch media during the COVID pandemic, where she commented on her experience in containing the 2003 SARS outbreak in Singapore, and later on the impact of speed science, high-speed science, open science, and research integrity during the pandemic. She's going to talk about what we've all been waiting for, which is the key findings of the NSRI and implementation year. Please welcome Dr. Gopalakrishna.
Hello, good afternoon, good morning to people who are joining us also online from different parts of the world. Thank you so much, Jeroen, for these very kind words. However, I cannot take all of the credit for the national survey. I have some of my team members actually in the audience who really were spearheading this project together with me. I hope that I will not continue to paint a bleak picture of the research climate in the Netherlands and beyond. But I do have an optimistic note, which I hope to end on. So what I would like to do in the next 20 minutes or so, and I'll try to stick to my timing very strictly, is to give you an overview of the Dutch National Survey on research integrity, to share with you some of its main findings, which you may be familiar already with, but if you're not, then I will give you actually the main flavors. So the NSRI, in short, is basically a study, a landmark study planned in the field of research integrity with two main goals. And that is firstly to provide concrete prevalence estimates on three types of research behaviors: questionable research practices, research misconduct, and responsible research practices. But also secondly, and more importantly, to determine associative explanatory factors which may be associated or driving these three different types of research behaviors. So the typical bottom of the iceberg analogy. And in doing so, we hope to be able to provide an evidence-based approach and better understanding to where and what kind of interventions we should be focusing on, primarily at the institutional level. Now, while the survey results have actually gained the most attention in this project, I also think that it is important to emphasize that the NSRI is a project that used a multidisciplinary approach and a mixed methods project. So basically here I'd like to give you an overview of the different stages. The project was granted for a period of 4 years. The beginning stages of the project involved extensive design of the survey instrument. We also conducted multiple numbers of focus groups across different disciplines and academic ranks, with the idea of trying to understand what questionable research practices meant to different disciplines outside of the biomedical field. We also conducted a number of pilot studies on psychometric testing of the explanatory variables, which were included in the survey instrument. And in the last year, I'll touch on some of the findings that we had when we sat down with researchers, policy advisors, and funders in the Netherlands to discuss what the findings meant and how can we translate them into actionable initiatives at the institutional level. The final survey itself was launched 2 years ago. I'm very happy to be able to stand here today and close the survey and report that we had close to 7,000 respondents who participated in the national survey in 2020. The survey instrument itself had a total of 75 questions, which we used a missingness by design in order to be able to reduce the time taken to answer the survey. I'll touch on that in a while. The launch of the survey, which happened 2 years ago, was nationwide, so we addressed all researchers from PhDs to full professors in 22 academic institutions and university medical centers across all disciplines and academic ranks. So very quickly, what is actually unique about the national survey? Well, there are a number of features which makes it quite unique in the landscape of research integrity surveys. The first is the missingness by design, as I mentioned to you. In order to try to limit the response time of surveys, given that we are living in a world where there is survey fatigue, there are a growing number of surveys not only in the field of research integrity. We did pay some attention to trying to shorten the amount of time it would take to answer the survey. This ended up with us using a missingness by design, where a randomized selection of questions were proposed to respondents, cutting the response time to roughly about 20 minutes. Privacy was obviously of concern for us, and we tried to accomplish this in a number of ways. We used the randomized response method. You may be familiar with this method. It's basically a method which has been around for quite some time, primarily in the field of sports medicine and social security fraud, but we introduced it in this survey, particularly for answering sensitive questions on research misconduct. What it does is that it creates a probabilistic rather than a direct association between the answer of the respondent and the true answer. And in this way, it has been shown to elicit more honest answers. We also actually only collected demographic data on 3 levels, which was also what the analysis was based on, with the idea of strict privacy protection measures, and we used a trusted third party who sent out the survey, de-anonymized the surveys, and sent that back to the research team. With respect to the survey itself, as I mentioned, the 2 goals were not only to measure prevalence estimates, but also to be able to explore the associations with a number of explanatory factors and what they meant to the 3 different research behaviors. And finally, the survey itself, as I mentioned, targeted the entire population of academic researchers in the Netherlands, making it one of the largest and most comprehensive research integrity surveys to date. So just a quick word on the landscape of research integrity surveys. So what you see here in the slide is taken from 2 systematic reviews, 2009 and 2021, with a total of 54 different surveys in research integrity that have been conducted. So just a quick landscape, we see that the national survey has the 2nd largest number of respondents, right after the survey that was conducted in Norway. Also, in terms of response proportion, we had a response of 21%, which falls in the wider range of the number of surveys that have been conducted in research integrity, although on the lower end of the spectrum. And it is one of 5 studies that have been looking at a multidisciplinary perspective in its target population. So a quick word on the explanatory factors. There were 10 explanatory factors, so the bottom of the iceberg, that we looked at to determine the associations between the different research behaviors and what might be driving these behaviors. So we looked at work pressure, publication funding pressure, publication pressure, competitiveness, scientific norms subscription, peer norms subscription, responsible mentoring, survival mentoring, organizational justice, and perceived likelihood of QRP detection. Just to dwell a little bit on the explanatory variables, maybe less familiar with some of the audience, I would like to mention scientific norm subscription, which also came back as being significant in our association. I'll show you those results in a minute. So shortly and affectionately termed as kudos, or the Mertonian norms, these encompass 4 different scientific norms or ideals that was proposed by Robert Merton in 1942. And these basically touch on ideals such as researchers not being motivated by personal gain, that researchers should judge one another's work on the quality of their contributions, that they should consider all evidence and those, including those that challenge or contradict their work. So this was largely a scale that asked questions on how researchers perceived their adherence to these scientific norms and ideals. Seems that my slide is not right. And then I wanted to touch on organizational justice. And here on organizational justice, we chose to look at organizational justice at the institutional level. And we looked at it in two different ways in this particular scale. So we looked at whether the distribution of resources, promotion, responsibilities within a department were fair. We also looked at processes around allocating tenure, criteria for tenure, whether these were transparent and consistently applied, and so on. Two other scales that I want to quickly touch on as well, which you will also hear later on from my next speaker, is on mentoring. We looked at mentoring in two ways. So we looked at responsible mentoring, and these were questions largely that focused on whether supervisors guided researchers on the responsible conduct of research and their practices. And we looked at survival mentoring, which focused on whether supervisors were more focused on teaching one the art of survival in academia rather than focused on the quality of their research. So that in succinct are basically the 10 explanatory variables. Here I wanted to just mention the scientific norm subscription again, but I'll skip that slide. So going on to the main results, I mentioned to you we had 6,813 researchers, 21% response rate, low on the scale, but still within the range of what we see in the larger domain of research integrity surveys. Two of our main papers have been published. One is still pending peer review. Well, actually, we have been peer reviewed, so it's pending publication. But you can find them online and find all of our results there, including the survey instrument, which we hope will eventually be replicated in another country or in another institution. So quickly moving on to the main results. So on this slide, you see here the most prevalent QRPs. So we defined prevalence as researchers who chose 5, 6, or 7 on the Likert scale, meaning that they were engaging in these questionable research practices sometimes too frequently. And these are the 5 most prevalent questionable research practices. You see that they are around the range of 15 to 17%. We also then looked at how frequently researchers were estimated in engaging in at least one of the 11 QRPs that we asked. And these numbers are bleak, but they speak for themselves. The percentage here is 51.3%, so that's 1 in 2 researchers who admitted to having engaged in questionable research practices in the last 3 years. So unfortunately, these numbers are not very promising. When we looked at research misconduct for falsification and fabrication or having committed either one of them or both, this was 8.3%, and that's 1 in 12 researchers. So fairly daunting numbers. Well, the upside of the picture, and there is always an upside of the picture, is that we did also ask a number of questions on responsible conduct of research. And here on this slide, you see the 5 most prevalent responsible research practices that researchers admitted to engaging in the last 3 years. And these are 80% or higher, fortunately. So frequently to always engaging in these behaviors. On the next slide here, I show you the open science practices. So these were slightly lower than the responsible conduct of research questions that we asked. So the range here was between 75% to a little over 40%, differing on the type of open science practice. Disclosure of codes and data and pre-registration of study protocols were the least prevalent across the board. What we found particularly interesting, and what you see on this slide, are the non-applicable answer options, which was also an option to answer any one of the questionable research practices or responsible research practices. And it's quite a busy slide, but I just like to focus and draw your attention here to the differences that we found in disciplinary fields. So we see that for the arts and humanities scholars, they had the highest percentage of non-applicable answers across the board for the most prevalent QRPs and open science practices, which tends to raise the question and a discussion on whether these non-applicable answers are bona fide non-applicable. Is it a lack of awareness, or is it that these are not standard practices? And probably the answer is somewhere in the middle. And we see the same trend with PhDs across the board. And when we look at open science practices that the survey questioned researchers on, we find that pre-registration of study protocols is the least applicable across the board, across different disciplines and ranks, but particularly for the natural and engineering and arts and humanities scholars. So what about the explanatory factors? What factors did we find strong associations towards helping or hurting research integrity? So here you see on this slide the significant associations. To make it easy for you in green, these are arrows indicating associations with a better responsible conduct of research or lowering the likelihood of questionable research practices or research misconduct. In red, they were associated with a worse outcome for research integrity. And these associations were derived from a multi-regression model containing 5 background variables and all explanatory variables. It is important to remember, and I would like to emphasize that this is a cross-sectional survey, so we are not proposing causality, but association. So what do we actually see here? Bringing it all together, the survey findings show us the point prevalence for the last 3 years of 3 different research type of behaviors. But we also see that the likelihood of detection of QRP by peer reviewers, scientific norm subscription, responsible mentoring, which my next speaker will touch on, organizational justice, are promoting better research integrity practices. What we found with the explanatory factors is that publication pressure, survival mentoring, and competitiveness lead to a worse outcome for research integrity. So no real surprises here. Very quickly, just looking at your own, that I'm still good on time, okay. So in the last year of the NSRI, we were quite busy with not only wanting to just having conducted the survey, but we also wanted to then feedback the numbers and these key findings to researchers to ask them what they thought of these key findings. How can they be translated into implementable policies or initiatives at the institutional level? So what we did was that we conducted 4 disciplinary specific work sessions that were academic rank mixed, and we had a last session where we feedbacked what the researchers told us about these key findings, the kinds of initiatives they would like to see back to a number of research funding organizations and to the research institutions themselves in a roundtable session. So I want to briefly touch on these results. So this is basically what we did in the last year. So from the period of October last year up till early this year, we conducted a number of these roundtable sessions. In total, we spoke to 64 different people across these 5 different work sessions. So what did they tell us? So here you see the priority areas. Unfortunately, I'll have to turn my head here because the slide is quite small. So what we identified were 6 different priority areas that were identified by the researchers. The first is to look at and encourage diverse criteria for researcher assessment. And I think one of our later speakers, Naomi, will hopefully touch on that. Secondly, they also identified and asked for promoting awareness and training on research integrity. And there was discussion and a request for an open and safe research culture, the importance to focus on team science versus individual recognition and rewards, to look at supervision and mentoring as being key and important in driving responsible conduct of research, and rewarding open science practices. So these were the 6 areas. They're not different from where the global direction of research integrity and the conversation is going, but also heartening and good to see the acknowledgement coming back. We also then asked these researchers to give us some tangible means in which these research institutions can implement policies or initiatives in these 6 different areas. So I just give you a quick flavor. There's quite a lot of words that's going to hit you now. So with regards to diverse criteria for researcher assessment, the request was to stop metric funding and funding based only on recognition based on funding. To recognize societal outreach, I'm just going to move actually this way, to recognize societal outreach, education, and supervision with regards to diverse criteria for researcher assessment. On promoting awareness and training on research integrity, there was a request to make research integrity education mandatory, but also to identify what are some of the key elements we need to include in research integrity training. So instead of only having research integrity trainings, to identify and standardize what are some of the core concepts and principles that should be included in research integrity training. With regards to open and safe research culture, there was a strong call to stop the shaming and silencing culture, to increase visibility in the reporting of questionable research practices, and to learn from ex-academics reasons for having left academia and how we can promote a safer culture, a research culture in academia. On focusing on team science, to increase the funding for teams and institutions. Supervision and mentoring, to look at rewarding and training supervisors and increasing the visibility of confidential counselors, and on rewarding open science to support registered reports and require pre-registration for funding. So this is my last slide. So other important aspects that came about in our discussion with research funding organizations in our last work session is that they have a strong and important role to play in supporting many of these calls for change, such as requiring mandatory research integrity training, recognizing supervision and mentoring as an excellence, as an indicator of excellence in research. Centrally coordinated research integrity platform was identified as a request where there can be a sharing of resources and experiences among institutions to have a better understanding of disciplinary similarities and differences. And finally, a word of caution that we should not only be simply changing the rules of the game, but we really need to invest in looking at changing the game in and of itself. Finally, on to the credits. This survey was possible because of a number of many different people, some of them in the audience here today, who I really want to thank. I've learned very much from my colleagues, and also to the universities who have supported us and researchers who took the time to participate. Thank you.
Thank you so much. Why don't you join me on the stage for a couple of quick questions? So here's an interesting question from our online audience. Marta Rink, she asks, I recently received email messages which had the sender's latest articles in the email, like the sender details. Would you say that's sort of questionable behavior, the sort of self-promotion that's doing?
So a sender actually promoting his or her own research? I don't see why not. I think that that's actually absolutely fine. I think that the reader should actually be quite self-critical. Well, I mean, the sender needs to be critical, but I also think that the reader should be critical and assess the quality of the research.
And this can help to do that. Yeah,
sure.
Who knows?
Yeah.
Questions from our audience here on site, maybe. Iris, Rosie is going to bring you the mic.
Yeah, so one of the last slides you showed that you said that your findings kind of reflect the research integrity discourse. Was there anything surprising that you found in the survey and all the other research that you've done that you would like to share?
Yeah, I think that there has been a lot of discussion, increasing discussion on disciplinary differences and similarities, and I think that this is something that we found quite clearly when we spoke with arts and humanities scholars, that there is still quite a gap between the discourse in research integrity, which has predominantly been in the biomedical field, and including and understanding exactly what these differences are, especially when we are moving towards rewarding and recognizing open science. So that was not surprising, but it was, again, a good echo of where we need to actually address some of the gaps in our understanding.
Thanks. So suppose we appoint you as the head of research in a university or research institute. What, based on your findings here, what would be the first thing you would start changing?
Yeah. I think that, research integrity training is a concrete way to go. There have already been a number of different initiatives, but I do think that we need an evidence-based approach to research integrity training. I think it's a low-hanging fruit, given that there are a number of different initiatives that are already available, but we need actually a better assessment of what is working and what is not working. So that would probably be something that I would like to start with.
Sounds good. All right. Unfortunately, we're running out of time, so I'm going to draw this session to a close. So please join me in thanking Dr. Gopalakrishna again. This was brilliant. And for the people online, keep those questions coming. We might be able to take them during the panel later today.